Thank you, Mr. Chairman. Thank you to all of our witnesses for appearing today. From the high cost of care to persistent and widespread shortages of care, the lack of access to affordable child care is straining the finances of families in every corner of my state. But I also hear from Wisconsin business owners who report that access to child care remains a primary barrier to hiring and retaining the employees that they need. I think Wisconsin has done well at using federal investments to connect businesses with child care needed for their workers. And I'm glad to have the opportunity to share a little bit of that story at today's hearing. However, I am concerned about the ability of families and businesses in Wisconsin to continue to utilize these types of partnerships when the available funding runs out. I'm also really concerned about our ability to provide meaningful investment to address the child care crisis under the constraints of the debt limit deal that is being debated right now in the House and will ultimately come to the Senate. Ms. Hogan, Wisconsin used federal dollars from our COVID-19 response to create an innovative program that helps businesses purchase child care slots for the benefit of their employees. This program, called the Partner Up program, has also pioneered an innovative true cost of care model, which I know has been referred to already, that allows participating child care providers to be paid what it actually costs to provide care to children, making it an attractive program for businesses and child care programs alike. But I'm concerned, as I said, when the federal dollars run out, that innovative programs like this, both in Wisconsin and nationwide, will end. So tell me, are we at risk right now of losing the momentum of addressing the child care crisis if we fail to make up for this shortfall? What are you seeing?
I would say the short answer is yes, though we trust that parents and businesses who really need this investment will continue to push for the investments that are needed. But it's unfortunate that the funding is ending because it is what you describe as such a great example of how a federal, state, business, parent partnership can really work. And there are other examples, your neighbor in Michigan, there's great examples of these pieces coming together to really meet the needs. And it really proves the point of what happens when the federal government makes these investments and states can respond to those needs in ways that are responsive to what's happening on the ground.
Great. I have a question for you, Ms. Mormon. As you well know, family child care providers provide indispensable services to families across the country. And I'm concerned about the fact that my state, Wisconsin, lost nearly 25% of its family child care providers in recent years. That's a dramatic drop. I've heard from Wisconsinites about the initial cost to become licensed, that it can be very daunting for would-be family care providers. And at the same time, I know that families and child care providers share a strong interest that these homes meet rigorous care and safety standards. Startup grants like those that were included in the Child Care for Working Families Act really helped child care providers meet licensing standards and offset these initial costs without sacrificing safety or quality. And in your role as sort of the head of an association of in-home family child cares, I'd ask you to talk about the importance of these startup grants. I'm trying to think of an example that everyone could relate to. Say you want to get in the business, but you don't have a fence around your backyard, and the children are going to be playing out there. That cost of just putting in the fence, which you need for safety, might be daunting in terms of overcoming that and making something work. So tell me a little bit about startup grants, in addition, of course, to reasonable reimbursement rates to help recruit and retain more family child care providers.
Yes, ma'am. More children spend time in home-based child care settings than any other child care setting. Family child care educators disproportionately care for infants and toddlers and children from low-income families, families of color, as well as families living in rural communities. Therefore, it is critical to ensure home-based child care providers have access to higher reimbursement rates and resources to start up their child care programs to meet health, safety, and quality standards. When I started my program, I had to make modifications to my home and purchase furniture and materials for the child care program. I used my savings since I didn't have income from child care yet. Steps to reduce barriers to licensing include providing startup grants and providing technical assistance from trusted advisors and coaches on topics like stages of child development, implementing a curriculum, and running a child care business. Family child care providers also face housing insecurity at an alarming rate. According to a Standard Rapid survey, over 1/4 of home-based providers were worried about being evicted from their homes.
Ms. Wong,
Wow.
time has expired.
Yes.
Thank you very much.